Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to Health Matters, a comprehensive chat with the Islamic Medical Association. My name is Dr. Shoaib Wadi. Alhamdulillah Rabbil Alameen wa salatu wa salatu ala ashrafil mursalin Sayyidina wa Nabiyyina Mawlana Muhammad wa ala alihi wa sahbihi ajma'een. Welcome to our show today. As usual, we start with some small advices. I'm going to recite from Surah An-Nahl. A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. ثم كلي من كل الثمرات فاسلكي سبل ربك ذللا يخرج من بطونها شراب مختلفا ألوانه فيه شفاء للناس إن في ذلك لآية لقوم يتفكرون. Allah subhanahu wa ta'ala says in Surah An-Nahl, then eat of all fruits and follow the ways of your Lord, made easy for you. There comes forth from their bellies a drink of varying color, wherein is healing for men. Verily, in this is indeed a sign for people who think. Alhamdulillah, in this recitation from the Quran, Allah subhanahu wa ta'ala has pointed out to us 1400 years ago through the beloved vessel of our Prophet sallallahu alaihi wasallam, the benefits of this drink, honey. We know honey comes through the bees collecting nectar and then processing it in a complex way and changing that one substance into a substance which suddenly is full of goodness and taste, which Allah subhanahu wa ta'ala says clearly in the Quran has healing within it. And only now, with the passage of time, medical science is starting to understand some of the healing properties of honey, some of its antibacterial properties, its use in wound care, its use in prevention of infection. So we see that within the confines of our Islamic heritage, Allah subhanahu wa ta'ala has given us deep understanding and knowledge, which only over time will become apparent. So sometimes, my message here is sometimes there are things within the Quran or within our Islamic heritage which we find puzzling or we don't understand. But the message is to trust in Allah subhanahu wa ta'ala, have tawakkul in Allah subhanahu wa ta'ala. Over time, many of these things will become clear and we'll start to understand how there is benefit in it for us. Sometimes it may not even be within our lifetime that we understand. Can you imagine some of the things which are contained within the Quran? People in the 12th and 13th centuries, to them, they were mysterious. They had no understanding of them. And only now, with the passage of hundreds of years, these things are becoming apparent. But the message for us is to have trust and tawakkul in what we believe that Allah subhanahu wa ta'ala has sent down to us. So Jazakallah. Today I'd like to welcome Dr. Yahya Atiyah. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
Dr. Atiyah is an ENT surgeon at Bergwanath Hospital and also in private practice at the Rosebank Clinic and the Pine Haven Clinic. Welcome, Yahya.
Jazakallah.
So today we're going to be discussing some matters around ear, nose and throat surgery. We'll have a general introduction, some of the common problems on ENT surgery. We've spoken about ENT surgery once or twice before on the show. I think our last talk was some time ago, so it may be good to have a refresher and to just explain to people what ENT surgeons do. And then we're going to concentrate specifically possibly on some cancers that ENT surgeons deal with. So yeah, just to kick it off, let's start off discussing what are the commonest conditions that you guys deal with?
So, Jazakallah, Shoaib. ENTs basically deal with any condition affecting the head and neck, except the brain and the bones of the head and neck.
Okay.
But even the bones, some of the bones we deal with as well.
But it's overlap.
So
there
for
must
example,
be overlap.
there's overlap between the maxillofacial surgeons and the neurosurgeons and
Sure.
the ENTs. So, some of the common conditions we see in children, particularly tonsillitis, acute infections of the ear and nose, that sort of thing. Ear conditions, hearing loss, wax buildup, dizziness, ringing in the ears, conditions of the nose, blocked nose, runny nose. A simple cold can be an ENT condition.
Right.
And then obviously the topic tonight we're going to try to focus on is the head and neck cancers.
Right.
So by and large, most of the cancers in the head and neck are managed by an ENT surgeon in conjunction with other disciplines, obviously.
Okay. So, some of those conditions are everyday conditions. I'm sure there won't be a person out there who hasn't at least had some problem with a runny nose or a blocked nose, maybe a bit of wax buildup in the ear, some difficulty hearing, maybe an ear infection. And these are really common conditions, particularly in childhood.
Correct. So, look, a lot of disciplines will tell you that a large part of GP practice is their discipline.
Right.
ENT is the one discipline that it actually holds true for.
Right.
The between 60 and 80% of your GP practice is going to be ENT conditions.
Right. So it's going to be sore throat,
runny
nose,
nose,
ear infections.
exactly.
Yeah.
All of those things are ENT conditions, even though you may not think of them as ENT problems.
I think one of the things about ENT conditions, and particularly these type of conditions, is that even a mild condition, so for example a cold or a flu, can have a substantial impact on someone's life, especially a child. So a child with a blocked nose is no joke. It really affects the child and the parents dramatically. The child can't sleep. They're very uncomfortable. So often those type of things will come to the attention of a doctor much faster than, for example, pain in the leg or something in the shoulder, which may also be self-limiting, but which people can get by without medical attention often.
That's right. So ENT is often described as a quality of life specialty.
Right.
So a lot of what we do a lot of life-saving procedures also, but a lot of what we do is quality of life. So for example, sinus surgery. Sinus surgery, by and large, is not
it's unusual to kill you, but it can.
But it impacts a lot on the patient's quality of life.
Okay.
The same with a child who's getting recurrent tonsillitis.
Right.
The child is not so much bothered by it. He gets his antibiotics and
he's better.
And he's better. The parents are the ones who feel the real impact because they sit up the whole night with a sick child. They have to go to work the next day.
He's got a fever.
He's got a fever, miserable child who doesn't want to eat, that sort of thing.
So, I mean, one of the commonest conditions, obviously, that you guys treat, especially in older people, as they move out of the sort of tonsillitis realm is chronic allergic rhinitis and sinusitis.
That's right. So, for the lay people, what most people would call hay fever.
Right.
So, you know, especially it can be the whole year or it can be seasonal. And most people have seasonal allergic rhinitis. So they have the sneezing and the itchy nose and the runny eyes.
And that's usually in the spring, early summer.
In spring, yeah. And on the Highveld especially, particularly in the spring, because that's when most of the grasses start to pollinate.
Right. I mean, what I often find with myself particularly is that there's like two peaks. The one is early in the spring, just as the grasses start to pollinate, and then just after the first rains, as the jacarandas come out and all the flowers come out, then you have a lot of pollen in the air. And I think many people, we see that with our patients as well. They tend to have huge flares at this time. One of the big problems that I have with a lot of patients, and I'm sure you guys see that as well, is the use of short-acting antihistamines, nasal antihistamines.
Nasal antihistamines, not so much, but the nasal vasoconstrictors.
Vasoconstrictors, so the Iliadins and Trixines and
xylometazoline, that's right, the Iliadins and Trixines, and Sinucon sprays and all of those kind of things. Yeah, so a lot of people think of it as a quick fix, and it is a quick fix, but the problem is that when you use it for a prolonged period, that your body basically gets used to it. And then you get a rebound congestion, what we call a rebound congestion, and the congestion actually gets worse. So now the patient has to use more spray, and the congestion gets worse.
It's a vicious cycle.
So it's a vicious cycle.
And we see that pretty often. I mean, I think sometimes GPs don't appreciate it because they may not see the same patient again and again, but I think sometimes they do. But especially in our practice where we see the same patient almost fairly regularly, the patient will be given a nasal decongestant and won't throw the bottle away. They keep it, and the next time the nose is blocked, they keep using it. And as you say,
or even worse than that, they'll give it to the family relative who probably doesn't have the same condition.
And then we have the problem. So what's a better solution then for that?
The better solution is, in fact, to get assessed by a doctor first.
Right.
It doesn't have to be a specialist. It can be a GP.
All right.
And take it from there.
Okay.
So, you know, not every blocked nose or runny nose is allergic rhinitis, number one.
Right.
Number two, not every allergic rhinitis needs the same treatment.
Okay.
So we started off as a stepwise treatment. We started with the antihistamine, then add on nasal steroid, add on saline. It may eventually progress to surgery.
Okay.
Allergic rhinitis, by and large, is not a surgical disease. It's a medical disease. But surgery does have a role to play sometimes.
Okay. Sometimes you develop polyps and chronic sinusitis and those type of things. So that may be a feature. The other common thing which aggravates a lot of ENT conditions, and we'll probably come back to this again, is smoking.
Yeah, smoking is one of my pet peeves, probably because I see so much of smoking-related disease. The problem with smoking is that you don't see its effects immediately. You know, if I give you a knife until you cut yourself, you'll think this guy's mad. But if I give you a cigarette, you'll think, he's been a nice guy. Meantime, I'm probably doing you a bigger disservice with a cigarette than with a knife.
Yeah, I mean, the problem is smoking, it's a slow killer, so you only see the effects many years later.
Yeah, and you know, most people are probably familiar with lung cancer. Lung cancer, compared to the head and neck cancers, is a very benign beast, if I can put it that way.
Yeah.
Because lung cancer, you'll have it for years, or, okay, in certain cases, maybe it's a short course. But by and large, the patient coughs. Eventually, they'll think, you know what, there's something wrong with me. Head and neck cancer, on the other hand, the patient, it's disfiguring. So the patient has a big lump in the neck, they have ulcerating tumors, that kind of thing. So besides the functional impairment, it also causes a psychological impairment because it's socially stigmatizing.
Absolutely, and you see patients with little pieces of a jaw or the head and neck missing out.
Or tracheostomies,
it's visible.
It's visible disease. That's
and it's difficult for people to deal with. We'll get back to the cancer of the head and neck. In terms of tonsillitis, we go back there for a little bit. I mean, tonsils are a normal part of our immune system initially for much of our lives. But why do some kids need to have them taken out?
So we have specific criteria for when we take tonsils out. So most people are worried about, no, my tonsils are big or my tonsils are small. The absolute size of the tonsils, in fact, doesn't make a huge difference unless they are so big that they are causing physical obstruction.
So you can't swallow.
And that is very rare. It's not common that you get a tonsil that is so big that it's causing such obstruction. So really the problem is now two things. One is the patient having recurrent tonsillitis? So that the old criteria used to be 5 per year. Now the Americans have moved it up to 7 per year. And that's 7 per year documented episodes by a doctor or
so I mean, this is affecting the child's life, the parent's life, as you mentioned. They're in and out of the doctor's office all the time. So yeah, so if the child is having the current episodes, and like I said, documented by a healthcare worker, not that the mother kept him at home and said, no, he had tonsillitis. It has to be verified by a doctor. So that's the one. The other one is that when the child is currently missing school, you know, because that obviously maybe not impacts on the child immediately, but long term will have an effect on the child's education and life later on. So I mean, there are a couple of other criteria, but in terms of the old argument that you should treat throat infections aggressively because of the risk of rheumatic fever?
Look, the rheumatic fever has by and large fallen away with the advent of antibiotics. You'll know better, but we still do see rheumatic heart disease, particularly in our poorer population.
And maybe missed rheumatic fever when they were younger, which is often the case.
So we don't see streptococcal strep throat as often as we used to. In fact, I haven't seen one in years. So it's not as common as it used to be, but it's still something that needs to be, that people need to be aware of. You know, now we are at the other end of the spectrum, where patients are getting too many antibiotics. Now we're getting antibiotic resistance.
Yes, absolutely. How common is antibiotic resistance when it comes to pharyngitis, tonsillitis?
So tonsillitis, you know, we used to treat with a simple penicillin. Now we find that we need to step up to something like amoxicillin clavulanate. Particularly with the ear infections, now we're seeing that amoxil doesn't cut it anymore.
So we need
to step it up. So it's becoming a very real disease problem.
And in terms of complicated ear infections, are there common problems? I mean, just before we move onto head and neck cancers, the other common thing, which almost seems to be fairly and comes in and out, is grommets and middle ear effusions.
So just to explain for your listeners, a grommet is a little tube that we put into the tympanic membrane or the eardrum to drain any fluid and to equalize the pressure between the middle ear and the outside. The indications for grommets, again, there's a few, but one of them is recurrent ear infections. And then if the size of or the amount of fluid behind the eardrum is so much that it's impacting on the child's hearing, we put a grommet in.
So the fluid decreases the ability of the tympanic membrane to vibrate,
to move,
and so then the patient can't hear properly. And obviously in young kids that can have a significant impact because it affects their speech.
Yeah, remember, children learn how to speak by listening to you and me. So if they can't hear what we're saying, then they don't learn how to speak properly.
And then also it may affect the schooling.
That's right,
because then they're unable to hear what the teacher is saying. They're always struggling to hear. And you know, in a child in a class of 20 or 30 children sometimes gets buried under all the other kids, and especially if they're not confident, they may struggle to bring that out.
Yeah, we see a lot of children who are referred with poor school performance.
And they often picked up on routine.
It's a simple thing that they just have an ear infection.
Jazakallah. So we're going to come back after our break, but I'm going to invite callers to call in. We're going to be discussing predominantly head and neck questions, but Dr. Atiyah will, I'm sure, be able to answer any of your other ENT related questions. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Health Matters. We're discussing ENT problems with Dr. Yahya Attia, and we've been just giving a basic rundown of the common ENT conditions. But now we're going to move a bit more onto the topic we want to discuss today, which is head and neck cancers. So I will invite you also to call us in. The number will appear on the screen, and you can give us a call with your questions. There we have the number 011 086 7777, and I'm sure Yahya will be able to answer whatever questions you have, inshallah. So Yahya, we were talking about ENT problems, and we spoke about some of the common ones, but now let's get to head and neck cancers. We mentioned earlier that the majority of them are probably related to smoking.
That's right. Gee.
How much do you have to smoke to put yourself at risk? A lot.
It's like, how much do you drink to not be thirsty kind of thing.
Yeah.
So, some people, and a lot of our people will say, no, but my grandfather smoked for 30 years and nothing happened to him.
Yeah, that's a common
That doesn't mean anything. It just means that he had good genes and he wasn't affected by the carcinogens.
Yes, or he may have been affected in a different way. Maybe he didn't inhale.
Correct. Yeah, maybe he got something else. Yeah. So to answer your question, as far as I'm concerned, one cigarette is one cigarette too many.
Right.
No one should be smoking. It should be a banned substance as far as I'm concerned. The problem with cigarettes is that, as we know, they're physically and psychologically addictive.
Yes, sure.
So no one can say that, no, I can quit when I want. You can't quit when you want. You're fooling yourself.
Well, once you start, it's very difficult to get off it, yeah.
Sorry.
So obviously, because the smoke traverses your mouth, your nasal cavities, gets into your lungs, the primary cancers that it causes are of the respiratory tract. And many people are, as you mentioned, well aware that it causes lung cancer. But some people don't really realize that it can cause cancer anywhere in the respiratory tract.
Yeah, so smoking affects the entire aerodigestive tract, as we call it. So anything from the nose down to the mouth, the pharynx, the larynx, all the way down to the lungs. Right. And some of the common ones we see that people may not realize are caused by smoking is cancer of the tongue, cancer of the voice box, cancer of the pharynx or the back of the throat. Right. The tonsils can be cancerous also, and it's also related to smoking.
Yes. And obviously, if the smoking occurs in some of those areas, they may affect your ability to breathe, especially the larynx. They may cause blockages there. And usually the surgery, as you mentioned, is usually quite disfiguring. What types of surgery do you usually need? Say if you have cancer of the larynx, for example.
So a lot of it depends on how early the patient presents and the symptoms.
Okay.
So if it's a very small cancer, and a lot of patients will probably present with a smaller cancer because they have private healthcare. Okay. In the public service, we see a very different picture because the patients don't have access to good healthcare.
We're going to come back to that. We have a caller. Assalamu alaikum wa rahmatullahi wa barakatuh. Assalamu alaikum. Hello?
Good evening.
Good evening.
Yes, I wanted to ask. I have a child who had surgery of tonsillectomy on Thursday.
Yes.
But now the incident I had was that she started bleeding through the nose, and then she's having trouble eating now.
Okay. Ma'am, did she have a tonsillectomy and adenoidectomy, or just a tonsillectomy?
Both of them.
Both of them. Okay.
Yes.
Okay.
So, look, it's very difficult over the phone to give a definitive answer, but bleeding post-tonsillectomy is not uncommon.
Okay.
When it happens a few days later, how the tonsils heal once we've taken them out is that they form a layer at the back of the throat.
Like a membrane, yeah.
A membrane.
Yeah.
And after a few days, that membrane comes away. And when it comes away, it's like if you peel a scab off your skin. Yes. It bleeds a little bit. So that's not unexpected. When we worry is when the bleeding is so much that the child is spitting up frank blood.
Okay.
So if you see a little bit of blood mixed with the saliva, I wouldn't worry about it. You can give the child a little bit of ice water to drink or to gargle with. That should sort it out. But if you see that it's a lot of blood, so by a lot of blood, I mean you see only blood and no saliva, then you need to take him to an emergency department at the very least so that they can assess him and see what's going on.
Okay. And pain, you mentioned pain. I don't think pain would be that unusual. No,
pain post-tonsillectomy is common. Children deal with it much better than adults. Okay. Adults, the truth is that adults are big babies and they don't listen when you tell them that they must eat after the operation.
Right.
So if you don't eat, the muscles at the back of the throat go into spasm and the pain gets worse.
Okay.
And so you eat less and the pain gets worse,
So it's a
and you
vicious
get a
cycle.
vicious cycle again.
Okay.
So children handle the pain very well. They basically just get on with life and move on.
Okay. I mean, the operation was Thursday. How long would you expect the pain to last? Would it still be common for it to be
I
there?
think about the pain should be getting much better by now. So she may still have a little bit of pain, but your doctor would have given you some pain medication. So you can carry on using that. Within a week, usually the pain resolves almost completely.
Okay.
So I would suggest that if the pain is not better, maybe in the next 2 or 3 days, or if there's a lot of blood, then maybe go back to your surgeon and let them have a look and make sure there's nothing else going on.
All right. Thank you very much.
Okay. So just to get back, we were talking about we have some more callers. Assalamu alaikum wa rahmatullahi wa barakatuh. Hello.
Hello.
Walaikum salam. How can we help you, sister?
I am waiting to speak to the doctor.
Yes, go ahead. You are speaking to them.
Assalamu alaikum. I've experienced chronic ear infection since I was quite young, and I've had 2 tympanoplasts. I was wondering, do you think I should go for a third, since my GP says that there's still a hole in my ear, but it's quite a small one, but you can't see exactly whether it's on top or at the bottom of the eardrum.
Okay. You want to listen on the television, sister?
If there's no other questions, yes.
Okay.
Okay, so chronic ear infections can damage your hearing, and they cause holes in the eardrum. So the operation to repair the holes is called a tympanoplasty.
Right.
So what the sister is describing is that they take a piece of either fat or a layer of the muscle on the temple, and they repair the hole in the eardrum. Together with that, they may repair the little bones in the ear to rehabilitate the hearing.
Right.
Now, the problem with having the current surgery is that your success rate of rehabilitating the hearing goes down with each successive surgery.
Right. Right.
So, again, the best way to assess this would be to see an ENT surgeon so that he can do a hearing test, assess what's going on with the eardrum itself, as well as the bones in the ear. Chances are your ENT surgeon is going to order a CAT scan to assess what's going on inside the ear and to assess what previous surgery was done.
Right.
But that would be the way to approach it.
And I mean, obviously the underlying question for somebody like this lady would be, what was the cause of these recurrent ear infections? What's the cause often of these chronic recurrent ear infections?
So nowadays we're seeing a lot of recurrent ear infections because there's a lot of pollution. We live in a world where industrialization has taken off. So there's a lot of pollution. Children are going to crash very often. And you know, when you're exposed to a pool of children who all have infections, then the chance of your child getting an infection goes up. Yeah. So in young children particularly, if you can avoid sending the child to a crash, that would be ideal.
But it's not often possible.
It's not often not possible, especially in today's times. Yeah. And the second thing is, and now we come back to what I said previously, is that smoking.
Yeah,
an adult who smokes around a child,
it's criminal.
It's criminal.
Yeah,
that's the only way I can put it. That adult should not be around the child.
And obviously, sometimes adults smoking themselves also put themselves at risk.
And you know, Shoaib, the problem is that adults think that I can smoke outside and it'll be fine. It's not fine, because the particles cling to your clothes, and then you pick your child up, and the child is affected by those particles.
So I think that's fair warning for those adults out there with small children. We have another caller. Assalamu alaikum wa rahmatullahi wa barakatuh.
Good evening. I want to
Good evening.
To the doctor.
You're speaking to them?
Oh, I want to talk about I've got an itch in my throat, and I've had it for quite a few months now. And I coughed and coughed because I want to scratch that, which I've been to the doctor so many times. They've given me antibiotics, but nothing is helping. And I'm coughing with this just because I want to scratch it. I'm coughing.
A scratchy throat.
I don't know what it is.
So when you say you've been to a doctor, was that a GP or an ENT surgeon?
I've been to a GP. I've been to a GP.
Have you been to an ENT surgeon?
No, I haven't.
Do you smoke, sister?
Sorry?
Do you smoke?
No, I don't smoke. I don't drink.
Okay.
So scratchy throat is a common problem.
Maybe a post-nasal drip or allergy.
There's lots of things. I was about to say there's lots of things that can cause it. So one of the common ones is the post-nasal drip.
Yes.
And basically what happens there is that the lining of the nose is irritated, and so it secretes mucus in order to clear the irritation.
Yes.
And then the mucus falls to the back of the throat and tickles the bottom of the throat, and the patient has this constant
all the time.
clearing
Stuff
the
in the
throat
throat
all the time.
But I think it's even worse than that, because it really irritates me, and I'm coughing and I feel like I'm hurting my throat.
Yeah.
So,
well, that can be the case with the post-nasal drip.
Yeah,
really.
in fact, it can get very bad to the point where you're clearing your throat constantly the whole day through. What you need actually is, again, an assessment by an ENT surgeon who will pass a scope down your nose,
Yes.
assess the sinuses, have a look at what's going on the back of the throat, and you'll also be able to look at the voice box itself to see that there's nothing going on with the voice box that's causing your problem.
So that's what I would suggest, that you go through and see an ENT. That sounds like the right idea for you, sister.
Okay.
Thank you.
Okay.
I mean, obviously, the other thing which we commonly come up in that context is reflux. But maybe we can discuss that after the break. So we're going to have another small break, and inshallah we'll be back with you to discuss some more questions, and maybe we can then finally discuss some things about head and neck cancer. Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome back to Health Matters, a comprehensive chat with the Islamic Medical Association. We've been getting several callers now, and before we move on, we were trying to discuss some stuff around head and neck cancer, but I think we'll take the calls because we have quite a lot of calls today. Assalamu alaikum wa rahmatullahi wa barakatuh. Hello? Hello? I think the caller is busy with something else. So maybe we can take the next caller. Assalamu alaikum wa rahmatullahi wa barakatuh. Okay, all right. So we'll see if we can get that caller back. Here we were discussing a little bit about head and neck cancer. We spoke about smoking. What else are the common causes of cancer of the head and neck?
So amongst the more traditional Indians, if I can put it that way.
Yes. Pan.
Betel nut tree, pan.
Right.
Betel nut is carcinogenic, meaning it causes cancer.
And so often of the mouth and the oral cavity.
Mouth, tongue, oral cavity.
Because they often don't breathe it in.
That's right.
Do they get cancer of the esophagus as well?
They can, they can. Speaking of cancer of the esophagus, the other thing is drinking very hot drinks.
Right.
Causes a thermal injury to the esophagus, and that can cause cancer
so,
also.
I mean, you were wise not to put that tea in a saucer and blow it before you drank it.
That's right, yeah. The other thing is certain viruses, and now in the last couple of years, one particular virus has come to the fore, and that's the human papilloma virus.
Right.
It's the same thing that causes warts on your finger or genital
cervix,
warts, or cancer of the cervix. That's right. So we've seen a lot of those kind of cancers.
But I mean, is it the same subtypes that cause cervical cancer as that cause oral pharyngeal cancer?
Yes, in fact.
There is some overlap. So the vaccination may assist in that perspective as well?
The cervical vaccine hasn't been assessed in that context yet, but it's an interesting development for the future.
Well, obviously, cervical cancer is such a common cancer that obviously the vaccine would probably be recommended just based on that cancer itself.
That's right, yes.
So I mean, those are the common types of things which cause cancer. Obviously, Allah knows best. Sometimes some people can't identify what the cause of the cancer is. But what would be the warning signs? What type of things would tell a person, look, I actually need to go get checked out?
So the general rule of thumb is that if anything lasts for more than 3 or 4 weeks.
Even like that lady who was here earlier with a scratchy throat.
That's right, yeah. So a scratchy throat could be a symptom of something more sinister.
It could be something minor, but it's something to check out.
Exactly. So any symptom that lasts for more than 3 or 4 weeks, it's generally a good idea to get checked out. Don't say, no, I think it'll get better, let me use some over-the-counter medicine. Rather get it seen to. Worst case scenario, the doctor tells you, look, everything's fine. Or sorry, best case scenario.
Yeah.
The doctor tells you everything's fine.
Or it's something
Worst case,
minor.
it's something major. But the earlier you catch these things, the easier they are to treat.
So, for example, if you find a small polyp on the larynx or something minor, you may be able to treat it with a laser or a local treatment rather than having a laryngectomy and the whole thing removed. So that's an important thing. We have got a caller on the line. Assalamu alaikum wa rahmatullahi wa barakatuh. Hello? Hello? Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum.
Wa alaikum salam. How can How can we help you, brother?
Can you hear me?
Yes, we can hear you. Can you switch your TV off then? Maybe you'll be able, or make the sounds off then. Maybe you can hear us.
Okay. Okay, hear me now?
Yes.
Okay, I would ask the doctor that, this loco-biotal, why has it been discontinued? And the second question is about if you sneeze a lot, can you have any adverse effect on the neck?
Okay, that's a good question. All right.
So the locobiotal, I won't be able to answer why it's been discontinued.
Maybe I can answer. Maybe I can answer that. The locobiotal has been discontinued because a small proportion of patients had severe allergic reactions, which were life-threatening. So the company decided to discontinue it based on that. There's also some evidence emerging that local antiseptics like locobiotal may be contributing to drug resistance, to antibiotic resistance more than they're benefiting the patient, because the level of benefit is small and there's no solid evidence. So based on that, actually, I think the MCC may have requested that the company withdraw it. So locobiotal was withdrawn for that reason.
Yeah, we don't generally use locobiotal in ENT practice, so it's more
I think it's
GP medication.
In fact, it's usually prescribed by pharmacists and general practitioners and self-prescribed by patients. But
that's right.
I think patients think it works because it tastes terrible, but I'm not sure how well it did work.
To answer your second question, sorry, I forget what the second question was. The sneezing. So sneezing per se is not a bad thing. The problem is that when you have comorbid conditions such as arthritis of the neck or any nasal condition, it may precipitate bleeding of the nose, or it may cause problems in the neck itself when you have arthritis. So sneezing by itself doesn't cause a problem. It's when you have other problems on top of it that it may be problematic.
Because there are some pressure changes in your airways during sneezing, but it's usually your airways can handle that. So it's unusual. I mean, people have described small blood vessels in your eyes popping, but usually those are harmless with sneezing. So I hope that answers your questions, brother. Okay, so we were discussing the treatment options and the warning signs. So you mentioned anything that goes on for more than about 3 or 4 weeks.
So to try to relate that to the head and neck, any ulcer in the mouth or in the nose or in the ear which is not healing is a warning sign.
Okay.
Anything that is one-sided. So alhamdulillah, we've been given 2 eyes, 2 ears, 2 nostrils, everything in basically 2s. So anything that is one-sided. So one tonsil that's bigger than the other one is also a warning sign. Ringing in the ear on only one side is also a warning sign. Any mass in the nose, for example, same story. Then going down to the voice box, a lot of patients will have a hoarse voice and they may ascribe it to laryngitis.
Yeah, so hoarseness is a common one.
So hoarseness is the first symptom of a laryngeal cancer.
Okay.
The breathing difficulty comes much later.
Yes.
Swallowing difficulty comes much later. Usually by the time you have swallowing difficulty, the cancer has spread and you've got problems.
Okay.
So any hoarseness that persists longer than a month, or in fact hoarseness I would say more than 2 weeks, you need to get it checked out.
I mean, there are other causes of hoarseness, obviously.
Particularly if you smoke.
Right, absolutely. Now we have another caller. Assalamu alaikum wa rahmatullahi wa barakatuh. Hello?
Assalamu alaikum.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
How are you, brother?
Alhamdulillah.
Alhamdulillah. How can we help you, brother?
I'm just hearing on TV, watching the ITV Islamic program, the healthcare. My wife got a problem with sneezing.
Right.
If she sneezes one way, I just want to know, is it allergy or what's the problem must be?
Okay. We can answer that. Can you listen on the TV, brother?
Yes, I'm sitting in front of you.
Okay, Jazakallah.
Yeah.
So sneezing is your body's way of clearing any irritation in your airways.
Right.
What happens is that the irritant gets into your nose, it irritates the lining of the nose, and your body basically tries to expel it.
Right.
So most likely, it's not 100%, but most likely it probably is allergy related.
Okay. Because that's common, especially if it's a constant
That's the
sneezing.
commonest cause. You get this, they call it machine gun sneezing.
Right.
So the patient just sneezes 10, 12 times in a row.
And I think many people out of that would have had short periods of this, and they get over it, and usually the life goes on. But if it's persistent, obviously it's going to affect your functioning.
Again, any persistent problem get it checked out.
Okay. So, I mean, brother, it's possibly an allergy, in fact, most likely an allergy, but I think you should have it looked at. Your doctor may be able to help, maybe an antihistamine, nasal steroid, we discussed it before, the common types of treatment for hay fever or allergic rhinitis, that type of thing. It may help. We were discussing so laryngeal cancer and hoarseness. You know, hoarseness is a very common symptom. Sometimes you talk a lot the night before, or you have a bit of heartburn or something, and your voice is a bit hoarse.
That's right. So, you know, we need to differentiate between hoarseness and dysphonia.
Okay.
So, dysphonia is where you have an abnormal voice, but not necessarily a hoarse voice. So,
Right.
some patients, for example, okay, maybe not in our listener population, but singers,
Yeah.
for example, because they sing a lot, they may get decreased projection of their voice.
Okay, so if Zain Bika is listening, you should just listen.
That's right. So, you know, it's not necessarily a hoarse voice, but they have vocal fatigue and that kind of thing. So we need to differentiate between the two of those.
But I mean, it may be, we often find that in young boys who are doing HIVs. So they read for long, prolonged periods of time, recitation. Sometimes they need to make sure they drink some water, rest for periods and so forth. During Ramadan, in Tarawih, we often find the imams have that fatigue of the voice box, and they do get hoarse sometimes.
That's right. In fact, our imam this year I had to treat him for a hoarse voice.
Yeah.
What people like that need to learn is something called vocal hygiene.
Okay.
So vocal hygiene basically relates to how you look after your voice.
Right.
Like you would look after any other body part of yours. You'll clip your nails, trim your hair. You need to look after your voice, particularly if you're using it in a professional sense.
Right.
So singing, reading Tarawih, that kind of thing, you need to look after it. So a speech therapist will be able to help you with that.
Okay. Mahmoud, sorry to interrupt you again. We have another call. Assalamu alaikum wa rahmatullahi wa barakatuh.
Good evening.
Good evening. How can we help you?
So I have a question for the doctors.
Please go ahead.
I've been suffering with a fungal sinus for 4 years.
Okay.
Now, I have just recently had my latest operation unsuccessfully yet again. I'm 78 and I'm desperately ill at times. And I would just like their opinion as to, I've seen several ear, nose and throat doctors.
Okay.
I recently had that operation done here at Midstream Estate.
Okay.
And 2 days after the operation, that was supposed to be going to be successful this time, my sinuses started pouring with pus again.
Are you diabetic, sister?
I beg your pardon?
Are you diabetic?
No.
Do you smoke?
No.
Okay. All right.
No. But we do have, just outside the gate of the retirement complex in Midstream Estate, a load of toxic waste gets dumped by the mine.
Okay.
From Malakana, and we've had that investigated, and nobody has got anywhere.
Okay.
And there must be about 300 people who are suffering with the sinus.
Oh, that's interesting. So, I mean, obviously you mentioned earlier that environmental pollutants can really affect your respiratory system. But fungal sinusitis, that's a complex and difficult problem.
Fungal sinusitis, yeah, it's a very difficult condition to treat. There's 2 types. The one is the acute condition that you get in diabetics and immunocompromised patients that is often lethal.
And maybe fatal, yeah.
That's right. So the one that the caller is describing sounds more like something called allergic fungal sinusitis.
Okay.
So there you get, the allergic rhinitis is the underlying condition.
Yes, but they're allergic to fungal spores or something like that.
They're allergic to fungal spores, that's right. And the funguses set up, either they form a little ball within the sinuses, or they grow into the sinuses, or something along those lines. And the mainstay of treatment is in fact surgery, but you also need to treat the underlying allergy. So look, I can't say what the caller has had. At 78, her immune system may be compromised anyway due to her age.
Yes.
And she may have underlying conditions like diabetes that you mentioned that is now exacerbating the condition, but hasn't been diagnosed yet.
Yes.
So it would be a good idea to visit an ENT again and find out exactly what he thinks is going on. The doctor is actually the one who should be explaining to her
Yes.
why the surgery was unsuccessful or successful.
But certainly, if there is an element of environmental pollution in that area, as a community, I think you should take it up with local health authorities, and maybe it's a public health issue because it may be impacting on a number of people in that community, and obviously it can contribute to immune suppression, especially if there's radioactive waste and so forth and so on. So I think you need to look at that, but it's a difficult problem to look at over just on this type of show. So we're going to go for a quick ad break, our last ad break, and then we'll come back inshallah to wrap up. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Health Matters. We've had a very entertaining show with a number of callers and some wide-ranging topics around ear, nose and throat surgery. We've got Dr. Yahya Attia with us, and really he's given us some detailed and interesting information. We were focusing a little bit on head and neck cancer, and we discussed some of the common symptoms of head and neck cancer, and also we just touched on some of the treatment options. Yahya, just to go back to some of the other ENT things that we just touched on during the show, maybe just before we wrap up, we mentioned reflux as a cause of ENT symptoms.
So reflux has gained prominence in the last few years as a cause of a whole lot of ENT conditions, in fact. So chronic tonsillitis, for example, in adults is often related to reflux disease rather than infections like in children.
Right.
In children, they've shown that reflux can in fact contribute to recurrent middle ear infections.
So this is reflux from the stomach, gastroesophageal reflux, coming up
from the stomach and irritating the throat. The patient who complained about the itchy throat can be reflux related. Hoarseness can be caused by reflux also. And then, you know, not quite my line, but a little bit lower down from the larynx, it can also exacerbate asthma.
Okay, yes.
Or it can cause asthma-like symptoms.
Yeah.
That's right.
Yeah.
So reflux is gaining prominence, and we find that we often treat the reflux in conjunction with other things.
Yes.
So we may put the patient on sinusitis treatment, but we'll also put him on a proton pump inhibitor.
Yes, to prevent
PPI,
that reflux.
To prevent the reflux. And some of the patients think this doesn't quite make sense.
Yeah.
But if you really ask your doctor to explain it, he'll explain it, and it will make sense.
I mean, we've certainly had patients where when you do a barium swallow or an assessment of how much reflux there is, the reflux is coming all the way up till the oral cavity. So you can see how some of that can spill over into the larynx, into the lungs, and can affect the oral cavity. And I think it just underpins the importance of seeing an experienced doctor if you have a chronic cough or chronic symptoms which are not resolving. You know, many of these things we treat ourselves at home.
That's right. So, you know, it's interesting you mentioned it can come all the way up. They did a study a few years ago in children where they found gut bacteria in the middle ear. And the only way they could have gotten there was through the eustachian tube up from the throat. And it's because the child was refluxing.
Yes, and I mean,
whether it's pathological, they didn't conclude that, but they found the bacteria.
So I mean, childhood reflux, I think, is underappreciated as well because we don't associate. It's normally thought to be a big fat adult problem, but it can occur in childhood as well.
In fact, most children reflux.
Yes.
So babies, particularly under the age of about 2 or 3.
They often regurgitate.
They all reflux. Okay. Every one of them has got reflux. The point is whether it's causing pathology or not.
Okay.
So not all reflux needs to be treated, and that's the point we need to make, I think.
Okay. So I mean, we're coming to the end of our show. It just leaves me to thank Dr. Yahya Attia for his information. Yahya, before we sign off, we just got a minute or so. I know you're probably gonna wax lyrical about smoking again, but if there one take-home message that you can give the audience in terms of prevention and avoiding ENT conditions, what would it be? I know it's difficult
I don't
to
think
sum
they
up.
should avoid ENT conditions because then I'll be out of a job. But
Well, they can't do anything about the air pollution, but certainly
Yeah,
they can do things about polluting themselves. Yeah.
no, I think the smoking, like, sorry, I tend to go on about it, but we see
but
a
it's
lot
accurate.
of disease related to smoking.
Yes,
So
yeah.
that's the one condition that people actually have control over.
Yes.
You don't have control over when the grass is pollinating.
Sure.
You don't have control over the pollution in the air.
You're right.
But you do have control over what you put into your own body.
Right.
So the smoking is the one thing, and the second thing is that if you have a problem, please get it seen to. Don't think it's going to go away.
I think that's another important message.
Just by magic
Yes.
or whatever.
Especially if it's been going on for 3-4 weeks, chronic cough, chronic hoarseness, an unusual ulcer in your mouth, a lump somewhere in your neck. Those are the type of things that you really need to have seen to. Don't expect it to go away on its own. Sometimes it will go away on its own, but rather be safe. So with that, I'd just like to thank Yahya again. Jazakallah khair. Thanks for coming, inshallah, and maybe we'll see you again on the show at some
Inshallah.
stage.
Jazakallah
Jazakallah khair. All our viewers, Jazakallah for listening, and thanks for all the calls. We pray that Allah subhanahu wa ta'ala grants shifa to all those who are suffering out there, all those who have difficulties. We even pray for those in America who are suffering under the yoke of the future president. Assalamu alaikum wa rahmatullahi wa barakatuh.
Amen.